What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.
And we welcome back Hoag Medical Group. They've been on before with us. It's nice to have them back. And we have Dr. Hoag Shun. Nice to meet you. You work, as you were saying right before we went on, Irvine mainly, but also go down to Newport. And you kind of go back and forth between the two.
Sure.
You are a diplomat, the American Board of Internal Medicine, as well as the American Board of Geriatric
That's true.
Medicine.
Yeah, I finished my medical school in China.
Oh, really?
Then I had
Okay.
3 years internal medicine training and 2 years geriatric fellowship training.
Okay.
After that, been practice full time for 13 years. Yeah, being a physician, I'm happy to help people every day.
Good.
And the Hoag Medical Group is newly formed, a primary care group.
Mm-hmm.
And we have 8 locations in Orange County to serve community.
All right, very good. Well, you wanted to talk about today the philosophy of successful aging, which of course for this community is very important. And often you hear that term, and what does it really mean to you?
Actually, the successful aging is to live long and stay healthy. Mm-hmm. Nowadays, people do live much longer.
Yeah, they do.
Yeah, and the average age is 80. But for our Laguna Wood Village community, everybody 55 and above. I think average age is 70-ish, right?
Yeah,
and
about 77, 78 or something like that.
Right.
In there.
For this age group, actually, we're expecting most people live beyond 90.
Yeah.
So be prepared. So the key thing is stay healthy. You know, physically and mentally. You still have your muscles, your brains, you do things you like to do, you enjoy them.
Yeah, and it's quite interesting the way you hear about people not only living longer, but keeping their vitality up. An example today on the news, they had something about Willie Nelson, and he's on tour, and I think he like twisted an ankle, so he's got to stop for a week or two. Mm-hmm. But they had a short interview with him, and he's 80 years old.
See?
And would we have thought,
So 80 years old,
like
and still
30 years
active.
ago, Willie Nelson will still be doing his thing at 80. He wouldn't even have thought of that.
Exactly.
And it's amazing.
Yeah.
So the whole concept of successful aging and staying healthy, we see that. We see it every day.
Yeah.
And it's amazing.
Yeah.
You're a trained geriatrician. So when people come to see you, that's a specialized, obviously.
Right.
When people first come to see you, what can they expect? Are you going to be asking specific questions, different than maybe a standard, I don't want to call him a standard physician, but you know what I mean, someone
Yes.
who is more internal medicine or something
Family
like that?
practice. Yes, we practice a lot of different. After the fellowship training and the 13 years experience, I do have very comfortably doing the geriatric assessment. When the first time patient come to me, definitely I spend the time to listen to their concerns and their stories, because from their concerns and the stories, they usually give me the clue how to help them the best to make them feel better. Also, geriatric assessment is from the head to toe, evaluation, very thorough and comprehensive. We do emphasize on the psychosocial well-being and their functions, if they still enjoying their life, and if they have some difficulties for the activity of daily living, like shopping, handling the medications, and paying the bills. And that's maybe the sign of the early dementia. The early dementia really treatable and prolong the good life, and they can, keep going with mental function. So a lot of things we do to improve their quality. If they have urinary incontinence and the falls, that's in the package of a geriatric evaluation. We can make them feel better. Yeah.
One of the things we're going to be seeing more of, just because people are aging longer. In fact, this was, I think, on the news just this morning, because there was some fundraiser going on, is Alzheimer's. And in the particular interview I was seeing is just how little has been done as far as looking for a successful treatment, maybe a successful prevention. We're just on the early stages of that. It seemed one of those things as large as that is becoming, that we have not done enough. We, meaning the entire medical community and just as a whole, even funding going to it. Is this something that you're obviously seeing more of?
Right. It's very often. That's the concern of how well you can be if you have dementia. And we emphasize initially, even during my fellowship training, that age, we only treat pretty moderate and advanced dementia. And we don't see much results with Amanda, Exelon, the medications, because that medications only slow down the process, not reversing it.
Yeah.
Right now, the concept is just exactly like you said. We need to do the preventive method. We can be really healthy through the late life. And also we emphasize on finding the new early dementia we call mild cognitive impairment. Even before that age, when we found it, we made the diagnosis, we start treatment. Actually, they can really go through their late life without much sign of dementia, because with the medications can play like 50% of a role for the benefit. Another one is the exercise, 25%, and the mental exercise. Even you can start taking a college course or whatever, and the brain exercise games, those three components can have like 100% maximized capacity to keep you going, your brain-wise.
Yeah, and it's interesting.
Very important.
The tools that people have today, things like having a tablet device.
Yes.
There are countless mind games on there.
Right.
Most of them are totally free.
Right.
There are courses on. One of them I think is called the Khan University, KAHN. They are full, kind of brief university courses. Totally free that you can take online.
Definitely.
There's
1 hour a day.
It's
probably.
amazing.
That really keep you going. We see a lot of phenomena. When we early diagnose the patient has dementia, we intervened with all three methods. They keep going, no difficulty.
Yeah, just learning something new.
Exactly.
Almost on a daily basis.
Yes.
Whatever it might be, read a little article about something new stimulates it.
Right. Exercise is also very important because the newly study published like last year, and the researchers did a study, separated people to two groups. One is exercise group, another one is not exercising group. They assumed exercise group, probably the hippocampus, the little memory center in the brain, will not shrink that much, and the don't exercise group will shrink more. The MRI before and after for both groups surprisingly showed exercise group hippocampus center grew bigger. So exciting. the thing is, make people think when you do exercise, you secrete some fertilizer to that center and make it
Interesting.
enlarged. So far the medication doesn't do that.
Yeah.
So exercise, regardless of what you can do, even you can do the chair exercise.
Yeah.
If you're pretty weak with your legs, or even simply walking. Definitely golfing, swimming, running, jogging, tennis, everything will be fine as long as you enjoy it. Can be long lasting. Go do it.
Yeah, stay both mentally and physically active as much as you can.
Very, very good.
Yeah, well, very good. Well, I think you've given some great advice here. And if people want to sign up with you to become a patient, have you as their geriatric caregiver, the number's on the screen. It's Hoag Medical Group, 949-791-3070. They can call that number.
Sure.
And they can ask about you, Dr. Hong Shun. It's been a pleasure.
Thank you.
Yeah, we'll have to have you on again sometime.
Thank you for the opportunity.
Great.
And I can serve our community.
All right. Thank you.
Thank you.
Folks, we'll be back in just a moment.
Thank you.
Good job. Yeah, it was very good. See, you didn't.
What's happened to healthcare? It wasn't so long ago that your doctor understood your health history because they were part of it. From labor pains to life's health challenges, you could rely on that relationship with your family physician. Then something happened. Healthcare changed. Seeing a doctor can feel like running into a stranger. A 60-minute wait for a 6-minute visit. Hoag Medical Group is here to change all of that. Our doctors do more than react to illness. They become your personal physician for life. Always listening, never rushing, helping to chart a healthy path together, walking with you at every turn. This is the way healthcare was meant to be, with enhanced features such as same-day appointments, care coordination, and direct access to Hoag's world-class professionals and services. Hoag Medical Group. We listen, we care, we're committed to you for life.